There could be something in your bathroom cabinet right now that's slowly affecting your memory, focus, and even your long-term brain health. It's not some rare experimental drug, probably something you or someone you know takes every single day for allergies, for sleep, for heartburn, or even for anxiety. These are everyday medications, and many of them have been linked to cognitive decline, memory loss, and even an increased risk of dementia over time. That doesn't mean everyone who takes these medications will develop dementia, but if you've been feeling a little more forgetful lately, struggling to concentrate, or noticing mental fog creeping in, your medication could be playing a bigger role than you think. And here's what most people don't know. There are often safer alternatives available. Alternatives that can help treat the same symptoms without putting your brain at long-term risk. By the time this video is over, you'll know exactly which types of medications to be cautious about, what they do to your brain over time, and most importantly, how to protect your cognitive health even if you need to stay on them. Before we begin, hit the subscribe button to support our channel and watch daily uploads on crucial senior health tips. Let's start with one of the most common and widely used groups, anticholinergic medications. You might not know the term, but chances are you've taken one before. These drugs are used for all sorts of things: sleep problems, allergies, bladder issues, motion sickness. Some names you may recognize include diphenhydramine, often sold as Benadryl, and certain sleep aids you can buy over the counter. They work by blocking a neurotransmitter called acetylcholine, which plays a major role in learning and memory. That might not seem like a big deal at first, but the brain relies on acetylcholine to help form and store memories. When that process is interrupted over time, especially in older adults, the results can be serious. A study from the University of Washington found that people who took high doses of anticholinergic drugs for long periods, 3 years or more, had a significantly increased risk of developing dementia later in life. If you're someone who takes allergy medication regularly or sleep aids that include these ingredients, it might be time to look for alternatives. There are options available that don't interfere with the same brain chemicals, and we'll talk about those later. Now let's move on to a second group that's just as concerning: benzodiazepines. These are prescription drugs commonly used to treat anxiety and insomnia. Names you might recognize include Xanax, Ativan, and Valium. They work by slowing down the central nervous system, creating a calming effect. And while they can be helpful in short-term situations, they're not meant to be taken long-term. Studies have shown that regular use of benzodiazepines, especially in older adults, is associated with a significantly higher risk of cognitive impairment and dementia. These medications can interfere with memory, reduce mental clarity, and even increase the risk of falls due to delayed reaction time and fatigue. Yet many people take them for years without realizing the risks. Doctors now recommend that benzodiazepines be used only for short-term relief, weeks, not months. If you've been taking one for an extended period, do not stop abruptly, as withdrawal symptoms can be serious. Instead, talk to your doctor about a tapering plan or safer alternatives. And what about medications that aren't technically benzodiazepines but are still used to treat sleep problems? That brings us to group number 3, often referred to as the Z drugs. These include medications like Ambien and Lunesta. They're often marketed as safer than benzodiazepines, and they are somewhat less addictive, but that doesn't mean they're free from risk. Z drugs also act on the central nervous system. They can help you fall asleep, but they may interfere with brain function over time. People who take them regularly report memory lapses, confusion, and in some cases, long-term cognitive decline. A study published in the journal BMJ found that frequent use of Z drugs was associated with a significantly higher chance of developing dementia over time. That's 3 groups already: anticholinergics, benzodiazepines, and Z drugs. These are incredibly common, especially among older adults, and the risks are very real. But what's more important is that there are often other ways to address the symptoms that don't carry the same long-term impact on the brain. Coming up next, we'll talk about a fourth group: medications for heartburn and acid reflux. That might not seem like they'd affect your memory, but have shown surprising effects in recent studies. We'll also explore a few older antidepressants that could be silently impacting your ability to think clearly. Let's keep going. Let's talk about a group of medications that might seem harmless on the surface because they're used for something most people wouldn't associate with the brain. I'm talking about proton pump inhibitors, or PPIs. These are the drugs many people take for acid reflux, GERD, and heartburn. Popular names include omeprazole, sold as Prilosec, and esomeprazole, better known as Nexium. They work by reducing the amount of acid your stomach produces. That can be helpful in the short term, especially if you're dealing with severe reflux. But these medications were never meant to be used forever. And yet, many people over 60 stay on them for years, sometimes decades. Here's the problem: long-term use of PPIs has been associated with vitamin B12 deficiency, magnesium deficiency, and an increased risk of cognitive decline. B12 is crucial for brain health. It helps with nerve function, energy, and memory. And when you reduce stomach acid for too long, your body can't absorb B12 properly. That can lead to fatigue, confusion, and in some cases, symptoms that mimic dementia. There are also studies suggesting that long-term PPI I use may change the balance of gut bacteria, which in turn affects the gut-brain connection. We're still learning how deeply the brain and gut are linked, but what's clear is this: your stomach acid plays a bigger role in your brain health than you might think. If you're taking a PPI, especially for more than a few months, it's worth talking to your doctor about whether you still need it. Lifestyle changes like adjusting meal timing, avoiding trigger foods, or elevating your head while sleeping can sometimes reduce symptoms without medication. There are also gentler alternatives like H2 blockers, though those come with their own risks we'll touch on later. Now let's shift to antidepressants, specifically older types known as tricyclic antidepressants. These include medications like amitriptyline and nortriptyline. While they've been largely replaced by newer antidepressants for depression, they're still prescribed for things like chronic pain, migraines, and sleep disorders. Tricyclics have strong anticholinergic effects, meaning they block acetylcholine, just like some of the allergy and bladder medications we talked about earlier. And as we've learned, that can interfere with memory, attention, and long-term brain function. In fact, some studies suggest that high cumulative use of anticholinergic drugs, including these antidepressants, is linked to a significantly higher risk of dementia in older adults. If you're taking one of these medications and you've started noticing mental fog, forgetfulness, or slower thinking, it could be more than just aging. The good news is that many people don't need to stay on these older medications forever. There are newer treatments that provide similar pain relief or sleep support without blocking key neurotransmitters in your brain. And again, this doesn't mean you have to stop suddenly, but it does mean you should have a conversation with your doctor about alternatives. So far, we've covered medications for allergies, anxiety, sleep, digestion, and mood, but there are still more. Let's talk about a group that millions of people take daily for a completely different reason: urinary or bladder issues. These are medications often prescribed for overactive bladder, frequent nighttime urination, or incontinence. You might see names like oxybutynin or tolterodine. And yes, once again, these are anticholinergic medications. They work by relaxing the bladder muscles, which helps reduce urgency and leakage, but in the process, they also cross the blood-brain. Again, these are anticholinergic medications. They work by relaxing the bladder muscles, which helps reduce urgency and leakage, but in the process, they also cross the blood-brain barrier and affect acetylcholine levels in your brain. That means they don't just relax your bladder, they can also slow your memory, reduce your attention span, and contribute to long-term cognitive decline. This is especially important for older women, who are more likely to be prescribed these medications and who may already be at increased risk for dementia. If you're on one of these bladder medications, it's worth asking your doctor whether a lower dose or a newer option is available, one that targets the bladder without affecting the brain. We've now talked about 7 major types of medications that can affect your memory and brain health over time. In the next part, we'll explore 3 more: medications for high blood pressure, antipsychotics that are sometimes used off-label in seniors, and surprisingly, even some over-the-counter cold and flu treatments. Let's continue. Let's continue by talking about blood pressure medications, specifically a group called beta blockers. Now first, let's be clear. High blood pressure is a serious health issue. Left untreated, it increases your risk for stroke, heart attack, kidney damage, and yes, even cognitive decline. So managing your blood pressure is essential, but the way you manage it can make a difference, especially when it comes to your brain. Beta blockers like atenolol, metoprolol, or propranolol are commonly prescribed to reduce blood pressure and heart rate. They work by slowing down the force and frequency of your heartbeat. But for some people, especially older adults, they can cause mental fatigue, sluggish thinking, and in some cases, even depressive symptoms. This doesn't happen to everyone, but if you've noticed that since starting a beta blocker, your brain feels slower or your memory isn't as sharp, it's worth mentioning to your doctor. Sometimes switching to a different class of blood pressure medication like an AC inhibitor or ARB can still control your pressure while being gentler on your mental clarity. And speaking of mental clarity, let's talk about a group of medications that's often overlooked: antipsychotics. These medications are typically used to treat serious psychiatric conditions like schizophrenia or bipolar disorder. But in some cases, they're prescribed off-label to manage behaviors in people with dementia or those who are experiencing agitation or sleep issues, especially in nursing homes or assisted living facilities. Medications like risperidone, quetiapine, or olanzapine may help calm symptoms, but they come with serious risks, including sedation, movement disorders, and faster cognitive decline. In fact, the FDA has issued warnings about the increased risk of death in elderly patients with dementia who are treated with antipsychotic medications. These drugs can dull mental sharpness and create a fog that's hard to notice at first, but worsens over time. They should be used with extreme caution in seniors and only when absolutely necessary, not as a long-term solution for behavioral issues or sleep problems. And finally, let's not forget the over-the-counter medications that seem harmless but can quietly affect your brain, especially when taken frequently. Many cold, flu, and allergy medications contain diphenhydramine, chlorpheniramine, or other anticholinergic ingredients. These are the same compounds we discussed earlier that interfere with acetylcholine and memory. So that nighttime cold medicine that helps you sleep through a stuffy nose, it might be causing more harm than good to your memory, particularly if you're using it often or combining it with other medications that already have anticholinergic effects. The challenge is, these medications don't come with big warning labels about dementia risk. You have to dig into the ingredient list, understand what those long chemical names actually mean, and look at your full medication picture, not just one pill at a time. That's what makes this topic so important. It's not just about any single drug. It's about how multiple medications interact in your body. It's about how your brain responds to that total load, and how over time the effect can be stronger than anyone expected. That brings us to the most important part of this discussion. What can you do about it? Because yes, these risks are real, but so are your options. And in the next part, we'll walk through the exact steps you can take right now to lower your medication risk, protect your brain, and have a productive conversation with your doctor without feeling overwhelmed or afraid. Now that you know which medications could be impacting your brain health, let's focus on what you can do to protect yourself moving forward, even if you need some of these medications for other important health reasons. First, don't panic. Many of these drugs are helpful, even necessary in the short term. But what matters is the cumulative effect, how long you've been on them, how many you're taking, and how they interact with one another. The longer the exposure, the higher the risk. That's why this isn't about stopping your medications cold turkey. It's about becoming informed, identifying which ones may be causing problems, and finding safer alternatives when possible. Start by making a full list of all the medications you take, including prescriptions, over-the-counter drugs, and even supplements. Then, bring that list to your doctor or pharmacist and ask a simple question. Which of these might affect my memory or increase my dementia risk? That conversation might feel awkward at first, but it's important. Many healthcare providers don't automatically bring this up unless they know it's a concern for you. So speak up. Ask about the anticholinergic burden, which means how many of your medications are working against acetylcholine in your brain. Ask if there are newer options or non-drug therapies that might help you manage your symptoms without increasing long-term risk. In some cases, reducing your medication load could be as simple as spacing out how often you take certain over-the-counter products, switching to a different class of drug, or finding a lifestyle change that helps manage symptoms naturally. Let's say you're taking a sleep aid every night that includes diphenhydramine. Your doctor might suggest a non-drug alternative like melatonin, or guide you through improving your sleep habits so you no longer rely on medication. Or maybe you're taking medication for bladder control that's affecting your memory. In some cases, simple pelvic floor exercises, reducing caffeine, or adjusting fluid intake at night can reduce symptoms without medication. Even with acid reflux, changing meal timing, eating smaller portions, or avoiding late-night snacking can reduce the need for long-term PPI use. And for anxiety or chronic stress, which many seniors understandably deal with, there are evidence-based therapies like mindfulness, breathing techniques, or cognitive behavioral therapy that can be surprisingly effective even if you've never tried them before. You don't have to make every change at once, and you don't have to stop any medication immediately, but just being aware, having that conversation, getting curious, and exploring your options is the first and most important step. And don't underestimate the power of nutrition, movement, and mental stimulation as part of your brain health strategy. Getting enough sleep, drinking plenty of water, walking every day, eating protein, fiber, and antioxidant-rich foods like leafy greens and berries, doing puzzles, reading, or learning something new. These small habits work together to protect your memory, just as much as avoiding harmful medications does. In our final section, we'll tie everything together. We'll wrap up with a reminder that this isn't about fear. It's about empowerment. You deserve to understand how your medications affect your brain and what you can do to stay sharp, independent, and strong as you age. Let's finish this strong. So here's what it all comes down to. You've learned that certain medications, ones that millions of people take every day, can have unintended side effects that quietly affect your brain over time. From allergy pills to sleep aids, anxiety medications to acid reducers, even drugs meant to help can come with risks we're only now starting to fully understand. And while that might sound concerning, the goal of this video isn't to scare you, it's to inform you, because knowledge is power. And when you understand the potential effects of your medications, you can take control of your choices. You can ask better questions. You can work with your doctor instead of being passive. You can explore alternatives, whether that means switching medications, adjusting your dosage, or making lifestyle changes that support your health naturally. You can build a plan that puts your brain health at the center, not just as an afterthought, but as a priority. And here's the good news. The brain is resilient. Cognitive decline doesn't happen overnight, and in many cases, when the source of the stress is removed, like a problematic medication, people often report feeling clearer, sharper, and more energetic within weeks. The fog starts to lift. The memory lapses become less frequent. That spark returns. But the first step is awareness. So if anything in this video made you stop and think, if you recognized a medication you or a loved one is taking, don't keep it to yourself. Share this with them. Bring it up at your next doctor's appointment. Print out your medication list. Ask about anticholinergics. Ask about brain health. These are the conversations that save lives and preserve independence. And if you've already taken that step, if you've noticed your memory getting better after stopping or switching a medication, share your story in the comments. Because the more we we talk about this, the more empowered we all become. Thank you for watching. And if you found this video helpful, take a moment to hit the subscribe button. We post clear, science-backed health advice every week, designed for people over 60 who want to stay sharp, strong, and independent without confusion